Punctal plugs have been around for years. We've personally seen a number of patients experience significant benefits from the appropriate use of punctal plugs. The question that frequently comes up, though, is when is it clinically appropriate to consider punctal occlusion? Recently, the Dry Eye Workshop 2 report, commonly referred to as the DEWS 2 report, was published and has given us additional guidance on this question. According to the DEWS 2 report, the management algorithm presented in this report does not represent a rigid, stepwise approach, but rather should be viewed as an organizational tool to use when initiating treatment of dry eye disease to select interventions likely to provide most benefit. It initially includes lubricants, appropriate nutritional support, environmental modifications, and appropriate lid hygiene and warm compresses. For step 2, they discuss tear conservation, where they specifically discuss punctal occlusion. Although the treatment requires a multitude of factors to consider, punctal occlusion remains a viable strategy for conservation of the tears on the ocular surface. We think that it's critical for patients to be absent of blepharitis prior to punctal occlusion. Please see episode 71 for guidance on contemporary treatment protocols of blepharitis. Additionally, we perform inflammodry to assure low levels of matrix metalloproteinase 9 on the ocular surface. This patient has low levels of inflammation as only the blue control line shows up. In a patient with levels of MMP9 that are greater than 40 nanograms per milliliter, an additional red line would show up as well. Additionally, patients who are currently using pharmaceutical treatment or may have undergone a procedure such as LipiFlow may also benefit from additional retention of the tears on the ocular surface. Another patient type that seems to do well with punctal occlusion are those individuals with contact lens-induced dry eye. But make sure that these patients have low levels of inflammation. Punctal plugs have an important place in our practices. Assure low levels of inflammation by verifying with the inflammodry point of care test. Also, consider punctal occlusion for patients who are currently undergoing therapy and need additional tears retained on the eyes. And for patients who have contact lens-induced dry eye and low levels of inflammation, consider punctal occlusion. Keeping these things in mind will help you optimize this treatment for your patients. We hope that this has been clinically insightful.